Good afternoon, good morning, good evening, everyone. Welcome to the ILO Social Protection Department's virtual launch of the World Social Protection Data Dashboards. We're very happy to have the audience here, all of you here with us. And we have a very special panel of speakers, and we will be beginning our program very soon. Before we do that, if I can just ask you to please use the chat function for any comments, questions, issues you want to discuss amongst yourselves. If you have any specific questions that you want to direct to the panel, I would please like to ask you to use the Q&A function that you should be able to see at the bottom of your screen. So use that function when you want to address a question or a comment to any of our panelists. So, as I said, we're very, very pleased to have this opportunity to share with you on the eve of the launch of our new World Social Protection Data Dashboards, a panel discussion discussing the content and the format of our data dashboards. As you know, for us, access to comprehensive social protection is very much seen as a human right. And as we know, it's a human right that also has very well documented social and economic payoffs. I would also argue that the extent to which the right to social protection is enjoyed is also a barometer of how inclusive our societies and our economies are. So to have a good barometer and to have that barometer function well requires robust, comprehensive and timely data, disaggregated by all the very important and salient axes of inequality, be it in terms of income, in terms of gender, in terms of race, or other important markers of inequality, so that we can track progress and also capture the persistent inequalities that remain and those who are excluded and not covered by social protection. Given ILO's mandate in the area of social protection and the fact that the ILO also has the custodianship for the compilation of data and reporting on progress made towards the achievement of SDG target 3.1, we're very pleased to share with you today this newly revamped World Social Protection Database and Dashboards, which we hope you will like, and we also hope that you will make very good use of it for the very important work that you do, whether it's as advocates, whether as researchers, policymakers, practitioners of social protection, whatever it may be, or journalists, or whatever you're doing. Now, in addition to the presentations of the dashboards that my colleagues, Fabio, Duran, Valverde, and Valeria Nestorenko will be making during the course of today's 2 hours that we have, I'm also really, really pleased and really honored to have around our virtual table a number of prominent data users and data producers, many of whom you will know by name and you would be familiar with their work. So without any further ado, let me be prompt with my use of time and move on and introduce our first speaker. I'm really, really thrilled to have with me today here Marcelo Caetano, who's the Secretary General of the International Social Security Association, a real partner for the ILO Social Protection Department and almost a member of our team, I can say. So Marcelo, welcome. And let me ask you a question that will not come as a surprise to you. ISSA works very closely with the ILO. We work very well together in providing the global data on developments of national legal frameworks and legal coverage, which obviously, from our point of view, is absolutely essential for a rights-based approach to social protection. Can you maybe tell us about some of the recent innovations in the way that you collect and compile this data, which I think it would be very interesting for our audience to hear about. And also maybe you want to talk about some of the challenges that you face in doing this really important work. Over to you, Marcelo.
Okay, Thank you very much, Shara, and thank you very much for participating at this virtual launch of the WSPDB and the dashboards as well. So good morning, good evening, good day, to everybody that is attending us. So beginning to answer your question, we should see that Social Security and social protection data, they are, let me say, a strategic asset for our work as international organizations. And ISSA has been producing this data for more than 20 years in an internationally recognized way, and it covers the social security systems of over 180 countries and territories in the context of one publication that we have that is named the Social Security Programs throughout the World, the SSPTW, that's the way that they will call it now, that's the way that we call it in ISSA. So when we do this and when we ensure the quality, ISSA benefits greatly from our global network of correspondents in the ISSA member institutions, in which we have more than 300 members of social security institutions and government departments all around the world. It is this unique global network of ISSA that provides the foundation of the ISSA country profiles, the SSPTW, and also for our strategic collaboration partnership with the ILO in the field of data. So this strategic collaboration, it's important to mention this historical perspective, it is in line with our respective mandates, ISSA and the ILO, since the creation of ISSA under the auspices of ILO in 1927. And it also supports an objective that is very important now, that is to promote social security and also universal coverage in line with the Sustainable Development Goals. ISSA is really pleased to be a key partner of the ILO in this role as a custodian of the United Nations agency responsible for the indicator 1.3. It's important also to highlight that when we develop high quality and comprehensive data, is something that is complicated and also costly. Therefore, this kind of work is to be carried out through joint activities, notably with the ILO. That's something that we do together. So in this line, we are actively working together with SOCPRO at about 3 years, 4 years since 2017 to share social security data. For us, it is a really significant recognition that our country profiles data is used for the flagship projects on monitoring the SDG indicator 1.3 and also to produce the World Social Protection Report. Some recent innovations that we are introducing consist of collecting structural variables for several parts of the social security programs throughout the world data, instead of the traditional test-based contents. And then we are expanding the scope of SSPTW, notably about via health systems as well as international social security agreements. Third important innovation that we developed this year in the context of the COVID-19 has been a process for collecting data related to social measures using automated monitoring, curating and publishing them in a classified way almost daily, almost every day. The main challenges are ensuring quality while expanding the scope of the data collected, especially when we work with limited resources. That is our case. We also have to permanently identify the information that is relevant for our members, institutions in ISSA. Beyond the current achievements, we believe that it's crucial to develop joint capacities to collect and to manage social security data, and this enables us and our organizations to respond in short delays to current and also to future challenges. So talking again, this collaboration with SOCPRO, sharing, for example, sharing data on COVID-related measures, this was implemented in less than one week. This shows that it's really important, but it's not just important, it's quite feasible. And the ISSA work plan for the triennium 2020-2022, it includes the improvement and the diversification of social security database. In particular, expanding the country profiles and adding data about international social security agreements concerning the protection of migrant workers. Some of these activities are already coordinated with SOCPRO, and there is also a preliminary work with the Department of Statistics. So I would like to highlight the importance of carrying out our strategic collaboration in this area. That's a quite complex area. So thank you very much, and I wish you all a very good event today.
Great, thank you very much, Marcelo. And I think that gives us a very good basis for making the segue to the next question I wanted to ask. But I want to make sure that Rafael is back, because I know that he had some energy problem and he had to be disconnected. And I'm asking if he is reconnected already with us. Rafael, are you with us, or should we?
Yes, I am connected.
You are back. Okay, perfect. Thank you.
Sorry for that.
Yeah, no worries. So I'm really pleased to be introducing to you Rafael Diaz de Medina, who's a colleague, a dear colleague. He's the director of the Statistics Department at the ILO. We're really thrilled that you could join us, Rafael. Now, Marcelo was just talking about the importance of the work that we do, particularly in terms of responding to and providing the data on SDG 1.3. And your department obviously monitors a number of different SDG targets for which ILO is the custodian, including several of those ones that relate to issues of work and employment, particularly under Goal 8. So what would you say, because you have a really good bird's eye view of those indicators, as well as the indicators that SOCPRO is a custodian for under our 3.1, target 3.1. What would you say is quite sort of different or unique about monitoring of SDG 1.3, which is the SDG that obviously many of our audience are concerned about, assuming that we have many social protection specialists in our audience? What would you say is different or unique about SDG 1.3 compared to many of the other SDGs for which ILO is a custodian? Over to you.
Thank you, Shara. First of all, thanks for inviting me and be with this in this such an important event. I think we are now today very proud to join you in the presentation of this revamped data dashboard that it's really very good and will surely be very helpful for policymakers and also for the SDG monitoring, as you mentioned. That the ILO has been since day one in 2015 negotiating hectically to have a set of indicators to cover all the indicators related to decent work. And of course, social protection is one of the pillars of decent work in this regard. So I dating back to the 2015 and 16 and 17, where we were hectically negotiating the set of indicators. Of course, we saw immediately the specificity of social protection and the need to be actively including in metrics to monitor. And the challenge was, of course, we were confronted with this interagency expert group on SDGs that were owned by countries and driven by countries, different from the MDGs. And it was very clear that they wanted to have a very low number of indicators, but of course, covering 17 goals and 169 targets was not very easy. So the first thing that we were confronted in the social protection side is how to only focus on one indicator to cover such a variety of social benefits, and the need to be very present in goal 1, which is, as you know, is to end poverty in all its forms. So this was the first thing that it was unique, because we, in passing, of course, the negotiation was a bit harsh, but it was also a bit misleading, because to be very frank, 1.31 it's a set of indicators, since it embeds a lot of indicators. It covers children, maternity, unemployment, disability, employment injuries, old age, health. So it's really a composite index, in other words, and it's really, this was very difficult to swallow for countries, because they only wanted to have one indicator, but still it is one indicator, but it has a variety of things. This poses a lot of course, challenges on collecting this data. And of course, we were lucky to have a very old dating from the 50s, the Social Security Inquiry that you host in the Social Protection Department. And I think this was very important, and was a value added that we as an international agencies could add to the table. So the other key distinct feature, if you tell me, of course, is the sources. The sources of that, you know, in this is not only to get the information, but also to create capacities, to enhance it. We are in the middle of this so-called data revolution that it was launched precisely in 2016. And it's really how to innovate. So now we have different things, and the sources for social protection are a myriad of sources. You have ministries of labor, ministries of finance, of welfare, social protection institutions, all these things that are not the usual thing vis-a-vis the rest of many of the indicators that mostly are produced by national statistical offices. So of course, national statistical offices now are empowered at the national level. They are the ones responsible for reporting the SDGs. We are collaborators, but they are this owned by the countries. And this, of course, the type of sources are administrative sources, and these administrative sources, which are the basis for the social protection inquiry, I think are here to be modernized, are here to be supported. And this is a very distinct feature, because social protection, most of these indicators are coming from administrative sources reported by countries, but they need really further support. We all know the limitations. We have this dashboard that has all the information available, but there are also gaps that we have to help filling. So this is, I would say, the more distinct feature. Of course, the complexity of this and the responsibility that we have for goal 1, it's very important. And this is one of the things that I would mention. Thanks very much.
Oh, thank you so much, Rafael. I think that was really great. I think the fact that you highlighted the 3 kind of distinct features. One, the very composite nature of 1.3. I take it that under goal 8, we don't have many indicators of this nature, right? To this extent being a composite. The other, as you said, you know, we make it or break it at the country level. You know, countries are responsible for producing. What happens at the national level is absolutely critical. They're the data producers, and that is absolutely key. And of course, the reliance that we have on administrative data sources is also a very distinguished and distinctive feature. And I think that really makes a very nice segue for me to introduce my dear colleague, Fabio Duran Valverde, who is the head of the Public Finance, Actuarial Services and Statistics Unit under the Social Protection Department of the ILO. And I have a question for him. And before I pose the question, I just realized that I didn't introduce myself. So I should just quickly say that my name is Sharon Azavi, and I'm the director of the Social Protection Department at the ILO. So apologies for that, for missing that initial introduction. So Fabio, I know that you have a lot to talk about, but we have limited time, so I'm just quickly going to pose the question to you. Can you just say what are the most recent developments in social protection statistics? And if I can also say, what are the main challenges that you're grappling with? I know there are many, but maybe you can highlight a few of them. Over to you, Fabio.
Thank you, Shara. I want to start by saying that the ILO has a long-standing record leading the collection of publication of data on social protection at the global level. So based on this experience, we observe an accelerated increase in the capacity of countries for data production, and this is very positive. Also, we observe an increasing demand for more and better information with no precedents, I think. So this progress in the capacity of countries for data protection is, which is driven by the rapid digitalization of social protection institutions, is a very positive trend. However, we observe that these changes are not automatically translating into the development of national statistical systems on social protection. And then we observe the typical fragmentation of social protection systems, in particular in developing countries, which Rafael mentioned, poses a serious challenges for progressing in this area. In addition, as was mentioned, the commitments of the 2030 Agenda are also bringing new challenges concerning the need for more and better information and monitoring and evaluating social protection systems. So without any doubt, this is a very challenging scenario. So in response to that, in 2016, the ILO Social Protection Department engaged in a project looking for results in several areas. The main of these results that were, the purpose was improving and adapting data collection to the SDG monitoring framework, extending and enhancing the content of the World Social Protection database, the technological update of our database platform, and also to contribute in a more effective manner to the creation of integrated national databases on social protection. As you can see in this timeline, in 2016, we started by developing an operational definition for the SDG indicator 1.3.1. As Rafael mentioned, this is not just one indicator, in fact, it's a set of indicators. So allowing us to do the first reporting in early 2017. Later in 2017, we started redesigning the SSI, which is our primary source of data, and then focusing in two areas. One is the content to tackle the new data requirements from SDG reporting, but also other requirements we had identified, and then redesigning the data collection process. In 2018, we undertook a major redesign of our World Social Protection database in two areas. Again, the expansion of the content and also the migration to a new IT platform. In 2019, we started a joint project with the ISSA. We were collaborating before, as Marcelo commented, but we started this project of, I would say ISSA is our most important partner on data. So the project was aimed at harmonizing the content of our databases and also for facilitating data exchange. This process is essential because it is allowing us to reduce human intervention and shorten the processing times, I would say with the mutual benefits for the two institutions. This process is not yet complete, but I would say that it is progressing with very good results. In the current year, which is a very special year, we have two projects running in parallel. One is the creation of the data visualization dashboard that we are pleased to launch today. And second is the implementation with the new online Social Security Inquiry tool, which my colleague Valeria will refer to it in the next presentation. So, well, I want to end my intervention saying that we are very proud of what we have achieved so far. But at the same time, we are the first also to recognize that there are many challenges and opportunities for improvements. One of the biggest challenges we see is how to really support countries more effectively for improving their national statistical systems in social protection and their capacity on monitoring and evaluation. This is critical. We see that fragmentation of the national, at the national level, data at the national level, caused by the fragmentation of social protection systems, is a critical challenge we have to face. Another significant challenge is to increase the counting of information on gender and also to incorporate data for specific vulnerable populations. For example, we already started collecting data for migrants in Eastern Africa with a lot of practical challenges, but we have started and we will continue progressing in this direction. Well, finally, it is worth to say that we are committed to continue working very hard to consolidate these results within a framework of excellence and quality. I want to say that this is a challenge that we assume with a lot of enthusiasm, as I would say, as always. So thank you very much. Over to you, Sharon.
Great. Thank you very much, Fabio. I think that was it was really helpful, I hope, for everyone to get a glimpse of what is in store, but also, as you said, I think it's really important to emphasize the importance of supporting countries, to be able to do that more effectively, as far as our role is concerned in SOCPRO. To really enhance their capacity on monitoring and evaluation of the data, as well as the content of the information that they produced. And I hope that we will hear a little bit more about that later from our colleagues who are here from Thailand and from Mozambique. So we will have time in the second segment to hear a bit more about both the innovations as well as some of the challenges that at the country level our colleagues are facing in terms of production of the kind of data that we as global actors very much depend on and rely on. So I want to now really get to the live part of the launch, and it's a great pleasure for me to hand over now to Valeria Nesterenko, who's our super efficient and productive data officer on social protection, who works around the clock, I think, in the PFACTS unit. That's the unit that Fabio heads under the Social Protection Department. And Valeria will give us an overview of this revamped World Social Protection data dashboards, and also she'll give us an overview of the Social Security Inquiry, and she will do all of that in 10 minutes. Valeria, over to you.
Thank you very much, Sarah. Hello, everyone. So I will very quickly go through the process of developing the dashboards, including data collection, the tools, etc. And then for 5 minutes, I will try to have a live walk through the dashboards. So after this meeting is done, you can easily navigate throughout the dashboards and find all the information that you're looking for. So as for the process, already several of my colleagues have mentioned, so we have the World Social Protection Database, which is a data compilation from many sources. The two main sources are SSI, which is Social Security Inquiry. It's a tool that has been used for many years already to compile data on social protection. And another major source is a source from ISSA, is social security programs throughout the world, as Marcelo has mentioned. So both are taking data from administrative records of the countries, the ministries, social security institutions, and other entities in the countries, and bringing the data through the questionnaire into the World Social Protection Database, where the data are processed, analyzed, indicators are calculated, etc. Of course, we are complementing this data with other data sources. And another, I would say, one of the major sources that we are using is ILO Stat, is the labor statistics database of the ILO. As well, we're using actuarial evaluations, NormLex, which is a normative UN World Population Prospects, OECD, Eurostat, IMF, World Bank, regional databases of ECLAC, Asian Development Bank, data from household surveys, assessment-based national dialects, and other different tools. So all of this is a part of the database. And then when the data are processed, analyzed, and validated in the database, we can see that the data are used in quite a few products that are public. And one of them that a lot of people know probably, it's the World Social Protection Report, which is our flagship report that comes out every 3 years, and the next one comes out next year in September. The second product is actually the dashboards that I'm gonna stop a little bit more in details today. Then, of course, we're producing a lot of technical and country reports that require data, and they're using data from our database. Another major thing is the reporting on the SDG goals that we're doing together with the Department of Statistics in February every year. The data are feeding our ILO social protection platform, and as well monitoring and evaluation frameworks, both at the national and international level. So from here, Social Security Inquiry is the tool that our department uses to compile the data. I'm not going to go live into the tool because it's an online tool that has been very recently finished, but it would be a completely separate presentation. So this is the questionnaire that is used to compile on social protection coverage, including SDG 131, access to healthcare, of course, benefit levels indicators, revenue, and expenditure on social protection. The questionnaire and all the related materials could be found on our platform. So there you have the link, available in quite a few languages. As I said, now we have an online version of the questionnaire that gives quite a lot of advantages, such as automatic survey management, centralized user database, and status of the questionnaire. One thing that is very important at the national level is that multiple users can work on the same questionnaire at the same time simultaneously. It has quite a user-friendly interface, the secure access to information because you have your own login and credentials. So this is the questionnaire for compiling and getting the data into our database. So this is my last slide, and then we go to the walkthrough. So currently we have around 151 variable and indicator in the database, and we are mainly dividing them into several groups. So we compile the and estimate, of course, indicators by country, demographic indicators, labor market indicators, as I said, from ILO Stat, macroeconomic indicators, and social protection indicators related to the country, like, for example, government expenditure on social protection or effective coverage of children in the country. We are as well compiling the information and analyzing by social protection scheme. And that would include all the metadata like administrative organization, type of scheme, etc. The key features, functions covered like old age, maternity, etc. Coverage of social protection scheme, expenditure, etc. And we go even more into detail of each scheme to add the benefit, because one social protection scheme, as you all know, can provide several benefits. And we are looking at the metadata, key features, coverage, expenditure level, and duration. So a little bit on what we have right now and what are the plans for the nearest future. So currently we're using ILO regions, which is Africa, Americas, Asia, and the Pacific, Arab states, Europe, and Central Asia. Next step is to have SDG regions, as we will have the next reporting in February. Of course, we will have as well, the dashboards and all the data available by SDG region, as well by ILO sub-region, etc. We have specific dashboards on the country groups. One of them is PALOP, is Portuguese-speaking African countries plus Timor-Leste, and ECASA, which is the East and Central Africa dashboard. Next step for us is to have separate dashboards for other country groups such as ASEAN, G20, BRICS, etc. As for number of countries, we have 214 countries and territories in the database. However, the dashboards themselves have a little bit less. They're displaying 187 countries. Updates that we are planning to do in the upcoming months. So the idea is to have a little bit more indicators disaggregated by sex, especially a few components of the SDG 1, like old age pensioners, contributors to pension scheme, and perhaps as well coverage by unemployment insurance by sex. We would have more tables available to download. We already have some information available to be downloaded, as this was requested by many people. And we'll have updated regional estimates. So right now, I'll close this and I will go to the platform itself. I hope you are still seeing it. So when you are entering the platform, and you will have, all of you will have the link, you see this homepage. It's a simple homepage. I will not stop at it with cards and main information at the world level. So the things that I want to stop at, because I think it's a little bit more interesting for you, it's here, the tab Data Dashboards. So the data dashboards consist of 4 different parts. It's the regional overview, country profile, maps, and data. So to go to the first one, at the example of Cabo Verde, this is the regional dashboard. So it looks like this. First of all, regarding the indicators, we have a table on the overview of social protection system in the country. So for every social protection function, you see if there is at least one program that is anchored in national legislation. We have background information, demographic information, some labor indicators, economic growth, etc., GDP per capita. So this for each country. Then we have in very big, you have effective coverage. You have 2 indicators. One is the population coverage by at least one social protection benefit. And another one is affiliation to health protection scheme. So this first one is the SDG 131 aggregate. And here on the right, you have the graph that is describing all the components that have been mentioned by Rafael. So disability, work age, children, old age, etc. So on the effective coverage indicators. Below, you have data disaggregated by sex on legal coverage by social protection function. And you have all the social protection functions here in the total, and then you have coverage of female and coverage of male. As well, you have information separately for contributory schemes and for non-contributory, and contributors divided to mandatory and voluntary. And of course, you can switch between seeing the information by working age as a percentage of working age population, or as a percentage of labor force. So on the left here, you have the public social protection expenditure by function. And so far we have social protection total and healthcare. We're planning to have more social protection function disaggregation here. And then you have some time perspective, so some time series on the expenditure. In the bottom here, you have the ratification of the ILO Social Security Convention by this specific country. So in the bottom, very important, we have sources and the note. The note is not extensive. However, if you're interested by the methodology, etc., you can click on see more and you have more information available. Other things that could be interesting for you. So of course here, I mean, you can either type in or just switch the country. And for example, if you want to see information on Australia, you can switch to Australia and you have the whole data set for Australia. Here you see this button, it says print. It actually brings you to a PDF file. So if you are interested in using this information for any of your publications or anything, you can just create a PDF. I'm not going to do it right now because it takes some time, but you can create a PDF and then use any of this information there. So here you have links to other regions such as ISSA and PALOB, as we have mentioned. You can see more information. These are other products that ILO Social Protection Department is developing. And you have another button which is called Download Excel, where actually you can download the data set in the Excel that is behind the dashboard. So most of these indicators by country and region you can already download. So another page which I think is interesting, it's the regional one. I'm not going to go through the graphs that are the same. They're just at the regional level. You have world, you have Africa. If you want to change, for example, and to have the overview for Africa, etc. Here you have a little map on social protection coverage, the same legal coverage indicators. You have expenditure in Africa on healthcare and total social protection. And as well, you have development of social protection programs by policy area, which is quite fascinating to see the difference because it's from 1900. It's quite fascinating to see the development, by each social protection functions in the region. So the same as the country one, you can make a PDF out of it, etc. So we know that there are certain users that prefer to see the information in the tables. Actually, I mean, I'm one of them. So for this case, we have created a page where you can actually go from each of either from the regional page, it's called tables, or from the country page, it's called tables. It's the same information, but more detailed and in the table view. So here you have information by region. So you can have on the regions, on the countries under the same region. You can as well look at specific country, for example, Argentina in Latin America. So these filters are used however you would like. So here we have information on the ratification of the Social Security Convention. We have information on legal coverage, and you would have a table by region, and then you have all the country information. And here you can switch from one function to another. You can go to children, you can go to maternity, etc. And for maternity, you don't have anything for male, so etc. So you have all this information available. As well, we have exactly the same table just for effective coverage. So you have regional and country information. We have information on social protection expenditure. And I think what would be interesting for you is the information that is being analyzed and worked on with ISSA organization is the key features of social protection programs. And here you have all the information by region and by country on social protection programs, the legal status, the programs available, the financing of social protection. For old age, you would have statutory retirement age, for each country. For some other benefits, for example, I switched to sickness, you would have all the same information with benefit level and duration of benefit, etc. So all this information is available for the social protection functions. here, and of course downloadable. We have another group of users who like maps, and for this we have created actually the same view but in maps basically. So here you would have you can go from here from data dashboards, and then you click maps. You can as well, select a region. For example, if we would want to see what's happening in Americas. And then you have the indicator here, effective coverage. You can switch from total population to other indicators. You can look at expenditure. You can as well look at the ILO Social Security conventions. You can relax the filter and go back to the world, etc. So of course, again, if you would like this map to be used in the publication, etc., you can create a PDF by clicking on this button, and then you can use it from the PDF. So here I'm finishing already. So these are the 4 main pages, the 4 main dashboards that I think are useful for you. The SDG 131, it's actually a map. It's just a map that is based on the components of the SDG. So it doesn't have expenditure and other functions, but it's only the SDG components. The data compilation, it includes information about Social Security Inquiry. The resources include useful links and one social protection report, as well. You have glossary and contact us if you are interested to know more information. Again, if you are interested and have inquiries about the dashboard or Social Security Inquiry, my colleague Zimin Yu, who has spent tremendous amount of time with me on these dashboards, or myself, we are very much eager to support you and to respond to any questions. Thank you very much.
Okay, great. Thank you so much, Valeria. That was a real tour de force. You took us through real highlights from the dashboard. Thank you so much. And there have been a lot of questions that have been coming in. Fabio has been trying to answer as many as possible, and I'm trying to keep track of some of them. Maybe I'll just pick up a few of them because we do have a little bit of time to just share, because although Fabio responded to some of them, it might be just interesting for everyone else to also hear the responses. There was one question asking us about how do we track some of the programs that have been put in place during the COVID period, and how can we get data on that. So maybe either Fabio or Valeria, you want to talk a little bit about the monitor that we have and that has been tracking. Maybe you can say a bit about that. Then there was a question about how different is this data, or how is it different, the data that we have on the ILO website, on the dashboards that you just took us through? How is it different from the data that the World Bank produces on social protection? So again, you choose whichever one you want, Fabio or Valeria, you can pick up on that question. We also had a question about how do we resource from Statistical Bureau? Or is it only from non-statistical bureau sources, social security institutions, from administrative data sources that they have? So maybe you want to tackle that question. I'm sure there are many others, but given the limited time that we have, maybe you just want to respond between the two of you, Fabio and Valeria, to that, or maybe you want to ask Zimin to come in if he wants to also come in. Please go ahead.
Maybe I can actually share the screen again, because I just opened the other dashboard, which is COVID related, and I respond to that question first. So I hope that you all see my screen. So during COVID period, let's say in March, April, ILO has developed another dashboard which is focusing on social protection responses to COVID-19 crisis around the world. And actually from one data dashboard, there is a connection to this one. So you can jump from one to another. There is a link. So as you can see, it captures the measures that have been announced by 209 countries, and you have quite a few, 1,569 measures. And the dashboard, I mean, it has very similar logics. You have graphs, so you have the measures already analyzed by social protection functions, type of measures, by region, etc. And you have them in the table view, which is basically the list of different measures with links. So you can see the information here on the map, in the graphs analyzed, then by type of adjustment, by function. And I mean, when you change the region from one to another, you can see that the information by function, by type, etc. It changes. You can as well filter the information by social protection functions. For example, if you're interested, you know, how many measures were on unemployment, you can just you know, filter unemployment, and you see that in 94 countries there have been measures that were supporting unemployed person during COVID-19 crisis. So, and all of the dashboard is being filtered based on unemployment measures only. If you want to go into more details and see on these unemployment measures, you see that filter stays, you go to table view, and you have all the information for all the countries that have implemented any social protection measures to support unemployed. As well, you have the original data source with hyperlinks, so you can click on them. So this is the dashboard that is being updated every week. So we have new measures, and this is something that we have been working with ISSA on data exchange on these social protection measures. So this is one question. Another there was regarding the data from the National Statistical Bureau, National Statistical Offices. Of course, yes, I'm sorry, I have forgotten to mention this. National Statistical Office is always in our correspondence, and in a lot of countries, they're usually even the repository of the administrative data, so we are in close contact with them, and of course they always are aware about the data collection that is going on in the country. I don't know, Fabio, I can respond to the question regarding the difference between the data from the World Bank and us. So the difference, the methodological difference is that the information that is collected by the ILO and analyzed by the ILO, as has been mentioned today by my colleagues, they are mainly coming from the administrative records. So they are part of the organization and administrating and management of the social protection scheme. So we receive the information for, you know, contributors, beneficiaries, expenditure, etc., at scheme level. And from the World Bank side, most of the information is coming from the household surveys. So the information is collected differently, and of course it represents different results, and it's done at different frequency, etc. So Fabio, if you want to come in here.
Yeah, may I add something which is important? I think that something that ILO database, World Social database has is that we do collect in collaboration with ISSA the information of the legal configuration of the system. So we are permanently updating the evolution of the systems in terms of their legal configuration, in terms of the parameters of the systems. I think this is an important difference.
Okay, thank you very much, colleagues. Just one more question we had, which I think is important that you kind of answer to that, because we're in the throes of doing it. It's a question about how you validate the data. How do you validate the data that you get from the country level? Can you maybe, Fabio or Valeria, say just very quickly a quick answer to that, and then we will move on.
Valeria, you
Sure.
that suffer with that.
Yes. So yes, we have an established data validation process with the countries. So actually on one of the pages of the dashboards, you can see the whole, you know, long process of data validation, etc. It's under the page about us. but so initially we sent the Social Security Inquiry questionnaire, the request, to the Ministry of Labor or any other ministry that is a focal point on social protection in the country. And then the information on this questionnaire is usually shared by this ministry with other institutions. So then normally it's a national effort to work on filling in this questionnaire, because as you know, the social security schemes are managed by different institutions at the country level. So when the questionnaire is complete, usually we receive this questionnaire and we have a look at it, assess the gaps, etc. We're returning back to the country with questions and requests. And usually the ministry that is the focal point, very often it's as well National Bureau of Statistics. They're having a look at this questionnaire and they're checking if the main schemes, they are in this questionnaire and the data are complete. Then, of course, we have a lot of ILO colleagues that are working at the country level. I think in our global team meeting, we have around 150 persons. So these 150 persons, of course, they're working at country level and they're following up with the request and they're validating the data together with the ministries. And then when we receive the validated data, we do the estimates, and usually we then send the estimates to, again, our specialists and the ministries and National Statistical Office, and the data gets validated. So it's quite a long process. But I think it's very important for us to receive some quality data. And second, it's important for national capacity development and monitoring and evaluation framework development at a country level. So I think that's it for me.
May I add that the reason we are developing a new online SSI tool is the idea of improving this, or introducing improvement to this process of data collection, which is very complex, because for one country, normally, if, for example, we have the situation in a country with maybe 60 social protection programs. This is the fragmentation I was referring. So we need to collect information from many different institutions for filling in just one questionnaire. So we are now launching this new tool that would allow us to improve the administration and the relation with the country provider institutions.
Okay, perfect. Thank you very much, colleagues. I think we're now ready to move on to the next segment of this launch. And we have for that segment two sort of panels, if I can call them that. And I want to sort of begin with the first panel and the first speaker on our first panel. And I'm really, really pleased to be welcoming Pedro Conceição, who's the director of the Human Development Report, a very important report of the UN based at UNDP. And the question I want to ask you, Pedro, in a way is a question that I'm asking because we also have, in addition to our dashboards and database, like you, we have a flagship report, the World Social Protection Report, which will be coming out in September of 2021. So the question I'm asking you is about the link between your report, the Human Development Report, and the dashboards. And what I really like to know is how you see the relation between the Human Development Report and the Human Development Dashboards, of which I believe you have 5 by now. And does the report, given its narrative and policy messages, that's always the added value of a report, that it's not just data, it also has policy messages and a narrative. Do you think the report brings traffic to your dashboards? Or would you say that the dashboards have their own users regardless of the report, and in a way may even attract people and bring traffic to the report? How do you see the relation between the two? So love to hear your reactions. Over to you, Pedro.
Thank you so much, Shara. It's great to be with you to learn about the great work that all the team at ILO on social protection is doing, and to share some reflections based on our experience here in the Human Development Report Office. In doing a lot of the work that you do, that we all do, which is to process, digest, and make available information to the public and to decision makers. So you asked a question about dashboards and the report, the analytical part of the report. I would add a third element there that's important for us, which are composite indices. Perhaps the most well-known is the Human Development Index of those that we produce, but we produce others on gender equality, as you know. We had discussions on this when you were at UN Women. Multidimensional poverty index. So I really see it as a triangulation, actually, not a dichotomy between dashboards and the analytical report, but a triangulation between composite indices, an analytical report, and the dashboards. And I think they all actually self-reinforce one another and generate traffic that brings people that would be more interested only in one dimension to be exposed to the two other dimensions. But let me perhaps share a few reflections on starting with the composite indices, because they are actually the ones that you asked about traffic. They are the ones that generate more traffic to our reports and to our dashboards. And the idea of a composite index is, or of the HDI, was simply to shift attention away from relying on GDP and trying to convey this idea that people should be at the center of development. And so the Human Development Index tried to propose an alternative by adding to an income component indicators related to achievements in health and education. But I think that even though composite indices are very influential, they get a lot of media attention, policymakers are also interested in understanding how the countries rank. I think perhaps the most value of a composite index is to help countries to progress their improvements over time. And I think this perhaps applies in the same way to when we rely on a single indicator like SDG 1.3.1. A disadvantage of composite indices is that they impose judgments, a number of judgments in the choice of indicators, in the way in which different indicators are weighted, and how they are aggregated. And often this is not really that transparent, and it's rarely based on fundamental axiomatic foundations. And therefore, that's why we invested for the last few years in presenting dashboards as a complement to composite indices. And I think it's important because when you provide information, and we've seen an example of the dashboard that we present, people can then use their own judgments, their own interests, their own aspirations to navigate the information in a way that is relevant to them, as opposed to being forced into the normative choices that are made for them when they rely on a composite index. So I think composite indices have their role, but dashboards are a very, very important complement. And in a way, I think that if we go back to the beginning of the Human Development Report 30 years ago, even though we didn't call them dashboards then, the report always included at the end what was called then and still today statistical tables. And the thinking was always that by getting people interested in a single index, they would get interested in the narrative part of the report, as well as in the additional statistical information that was presented in the form of statistical tables then and now in the form of dashboards. Of course, if we have a dashboard, then the difficulty is to decide on what to include, what to exclude, and how to organize the information. And here I want to really say how great the dashboard that we've just seen is, because it really shows that social protection should be understood as a system, not as a single indicator, not only as SDG 1.3.1, but really as a system that touches upon many different aspects of social policy with implications that span a range of sectors. And in that sense, it shines a light on this idea that social protection is not just SDG 1.3.1, but really cuts across the entire 2030 agenda for sustainable development and across all the SDGs. So this is more on the substance of the dashboards that you've shared with us. And I should also note, which is becoming more and more important, that's crucial to have something that is also accessible, visually appealing, and easy to navigate. And we're investing a lot in HDRO to make the information that we analyze, composite indices that we produce, much more easy to understand. And here again, I think that you did a great job with your dashboard. So let me just finish with this reflection again to reiterate that I think the important thing is to have this triangle in mind and not to go for an approach that tries to dominate over all others. I think it's important to have composite indices or some attention given to a single indicator like SDG 1.3.1. I think it's important to have that sort of focal point for discussion and to generate interest. Dashboards to complement and provide information that a single indicator or composite index cannot do. And then a narrative analytical part, like you have your World Social Protection Report, we have the HDR that draws on these two elements, but also provides more analytical narrative content to complement the information that is provided. So thank you, and looking forward to learning and seeing the evolution of the dashboards so that they can also inspire us to improve our work. Thank you, Sharon.
Great, thank you so much, Pedro. That was really very interesting, I think, what you had to say. And of course, the HDI and the gender indices are something that has, as you say, brought a lot of attention to your report and probably the traffic also to your dashboards. We don't have an index per se, like in the same way, and we don't rank countries, which is something that ILO consciously tries not to do. But I totally understand and know that a lot of the media attention that you get for the report comes from excitement about where countries are in the ranking. So I think that was really interesting. If I can now, you mentioned also the gender empowerment indices that you have. If I can move on now to our next panelist, a longtime friend and colleague, Camila Arza, who's a senior researcher at CONICET in Buenos Aires, Argentina. Camila, we're really grateful to have you on this panel. You work as a researcher on social protection systems. You're an expert in pension systems in particular and reforms, including from the work that you've done also has included work from a gender perspective. And you've now seen, Valeria went through the sort of dashboard very quickly, and colleagues said a few words about sex segregation that we have on some of our the data that we provide, and how much that is really dependent on whether we get sex disaggregated data from the national level, because that's what we ultimately are dependent on. So my question to you really is, first of all, how do you think that the World Social Protection database, the World Social Protection dashboards, I should say, that you've just seen, could become more useful for researchers like yourself? And beyond having, more data that is sex disaggregated, what other kinds of data do you think would be really useful to have to give us, much greater purchase on sort of gender issues within social protection, within social security systems? So over to you, Camila, for your thoughts and reflections.
Thank you, Shara, and thank you to all the organizing team, the Social Protection Department, for the invitation. And I'm really happy to be part of this panel. I am indeed a regular user of the ILO World Social Protection data, and I'm sure I will use this dashboard as well. I recommend it always to anyone working on social protection. I think we don't need to say much more about how comparative statistics are crucial for empirical research. But among all the contributions that the World Social Protection data and dashboard, I think, make, for our analysis of social protection, I would highlight the contribution to the analysis of coverage. Particularly, I think it's been very important, this distinction between formal and effective coverage, especially for low and middle income countries, where we know that there is a gap between what the legislation establishes and what the population effectively gets as a result of informal employment and other access barriers. So now, thanks to this data, we know a lot more about coverage. We know a lot more about the scope, the extent, the gaps across different social security branches and across countries. And then also in the past 2 decades, social policy research has put a lot of attention on coverage. We have used coverage indicators to complement data on social policy expenditures, which is the data we used to use in the past. And when coverage data opens the black box of expenditure data, it can provide information about whether social protection systems and specific branches of the social protection system effectively reach particular groups in the population. And this matters for gender equality as well as for equality across other groups like socioeconomic groups, regional groups, and so on. And the past 2 decades have also been a period of improvement in coverage across many countries around the world, particularly in Latin America, which is the region where I mostly worked in the last period, through the expansion of non-contributory benefits for children, for all the adults in particular. So more data, more research has helped us better understand the implications of this expansion and to monitor these changes, to characterize them. So I think that another positive aspect of this data is to try to make an effort to incorporate also the non-contributory benefits, the social assistance benefits to the vulnerable population, which have become so important in the social protection architectures, particularly in middle and low-income countries. That's why I think this data is so important, and this data dashboard in particular will be so much used by researchers like myself. I will make some thoughts or suggestions on how, as you say in your question, how can we make it more useful for research? And I think that, in particular from a gender perspective, I think that we've learned a lot about coverage, and we still know less about generosity of benefits and about the quality of social services, and also about equality in the distribution of benefits across the population, and including about gender equality. So first, regarding benefit generosity, I think this is a dimension that is increasingly considered a necessary complement for our analysis of social protection. Just as coverage was needed to complement data on social expenditures, public expenditure on social protection, well, now we need to characterize coverage with generosity. So in order to measure whether social protection systems meet the objective to provide economic security and protect against social rights, we need to know whether people receive a benefit, of course, coverage, but we also need to know how meaningful that benefit is, and the extent to which it can really provide genuine income security to the population, or whether it provides genuine income security to some groups or to others, to women and men, and how that compares. So one way to measure this is to look at the entitlements established in the legislation, as the International Social Security Association social security programs throughout the world does, and that's really, really useful. I've used that data a lot. But as happens with gaps in coverage between legal and effective coverage, quite often benefits received by the population differ from those legally established because several factors interact. For instance, in the case of pensions, workers may have shorter contributory periods than theoretically assumed, or benefits may get depreciated over time as a result of incomplete indexation. So data on benefit amounts effectively paid by each social protection branch, and ideally over time, I think, are important. And these data, of course, are important to monitor social protection in general, but also to monitor gender equality, because one of the most important gaps in terms of gender is not only coverage, but also the benefits that men and women get in practice. They may have the same entitlements, but then in practice they get different benefits. Another thing that I think that we could develop more, and is a bit more challenging, is quality, indicators about quality. For instance, in health, waiting times for different treatments, number of doctors per 1,000 population, things like that. These are just some examples of a dimension that I think we still need to get more information to compare and to monitor progress over time. And then another dimension I wanted to reflect on is equality. And this refers to the distribution of social protection rights and benefits across the population. So how is the population covered across the territory? How are benefits distributing across occupations, across socioeconomic groups, across gender groups? Here we are interested not only in coverage, so whether different groups in the population are covered in the same way, but also in the kind and in the generosity and in the quality of the benefits that each group in the population receives. So these multiple indicators, how do they distribute? And I think at this stage in which we are, that we have learned a lot about coverage, this is important because it will inform us about social protection gaps that may continue to exist even when coverage is high or even full. So these are gaps in terms of the kinds and quality of benefits that each group in the population receives. For instance, in Latin America and elsewhere, the development of non-contributory benefits has brought a massive improvement in coverage and incorporation of millions of people, but the gaps in generosity in some countries in terms of benefit amounts is very large. And finally, I think that looking at all these indicators or having more data on all these indicators will help us build multidimensional indicators for the monitoring of social protection. So combining all these dimensions, as was mentioned before, in the way that becomes theoretically relevant for each study, for each researcher. So, and for each one to monitor progress on certain on a multiplicity of indicators in a much more comprehensive way than just using one indicator alone. Well, finally, I would like to say something more about the gender aspect, as Shara was asking me. I mean, of course, all these different indicators that I mentioned before are relevant for gender equality, and in particular, continuing to develop sex disaggregated indicators on all of these dimensions, like legal rights, effective coverage, generosity, quality, conditions are very important. And these are the basis of what we use when we do gender analysis of social protection. But let me highlight very quickly two other points that could be part of this data. And one is indicators on gender relevant aspects of social policy design that could complement the data you already have on key design features of social security systems. For instance, do pension systems recognize period out of the labor force for childcare reasons? Can we have data on that for all countries? Another example, do social protection frameworks offer parental leaves that can be shared between men and women to promote co-responsibility in childcare? Or are there any other childcare related work leave options in the social protection framework? These are just examples of indicators of social protection design that reflect, I think, how gender sensitive social protection frameworks actually are in their design. And finally, one topic, I won't have time to elaborate much on this, but it's very important, is the issue of care, of course, for gender analysis. And in this, of course, we can address the issue of care with many different data, like household data, time use data, and so on. That is not the focus of your dashboard. But I think that with administrative data, we could include care as a dimension of its own right, a dimension of the social protection system, including indicators of the design of care services, of the coverage of existing care services across countries, the opening hours, which is something we don't have really to compare across countries and regions, the public-private mix in different countries, the amount of investment of the state in this area. This is a new area or a developing area of social protection. It's crucial for gender issues and for our analysis of gender equality and family dynamics as well. So I think it would be great if some of these could also form part of this amazing database that you really have developed, and that I'm sure we are going to use it very, very much. Thank you.
Great, thank you so much, Camila. I think you gave us, a wealth of, of ideas to follow through. I really liked, your emphasis on issues of adequacy and quality, also as issues that we can use for really gauging the extent to which social protection is equitable, whether we're looking at it from a gender or other axes of inequality. That the issue is not so, only the coverage, but we see greater inequality when we look at the degree of adequacy of benefits and the quality of benefits. And there's a lot of thinking still to be done in terms of how we bring the issue of quality into the kind of dashboards that we have. And thanks also for your ideas around sort of care and how really to look at the nature of the care services that are being provided, and your gender-specific ideas for bringing in a bit more sort of purchase into the kind of data that we're collecting on various areas of social protection. That's great, and I really would like now to move on we're really, really pleased to have with us Stephen Kidd, who will be someone who is probably very well known to many of you here. He is a senior social policy specialist in development pathways. The publications of Stephen and also of his whole development pathways outfit, I'm sure are very familiar to many of you here. So if I can just address a question to you, Stephen, first of all, welcome. And also to say that, you and your colleagues and your co-authors in development pathways, you make great use of data, and and you produce policy analysis on social protection that, really does a lot of myth busting, if I can say, questions a lot of the sort of easy assumptions and conventional wisdoms that are prevalent in this area of work, and often point to alternative policy solutions. So I think many of us really appreciate the quality of the research and the work that you do, which is so policy focused and so helpful for many of us. So maybe the question that I have for you is, how can the data that we provide in the sort of demonstrations that you saw, and I know that you have been looking through our dashboards, how can this become more useful for the kind of policy research that you do for people like yourself and others like you? And what do you want to see more of? What do you want to see less of? Or what do you want to see us do differently? I think I put in a few questions. That was a composite question to you. So have your take at whatever you want to, however you want to take that question. Over to you, Stephen.
Thanks, Shara, and thanks for the opportunity to have a few minutes to speak here. I mean, I've got to have a confession at the beginning, is that I love data, right? I love looking at, I mean, I'm a social anthropologist by training, so I shouldn't really love data, but I do. And I love dashboards like this. I mean, I think it probably goes back to childhood when, I was obsessed with cricket. And if anybody's obsessed with cricket, they know how important data is in cricket. And this is probably fed through to this real love of data. And I've already started looking at the database and going through it, because it's fascinating things that you can see and understand and learn. I mean, it's great. I mean, I think it's fantastic to see from the last version to this version, there's been big improvements already, and I think it's been a massive effort so far. I mean, just browsing through, I think you can see really interesting things. I was just looking at the spending on healthcare and comparing the United States with the UK. It was really interesting, thinking about the challenges Joe Biden's got of seeing the USA spending 8.6% of GDP on health, but only reaches 36% of its population. UK spends less, 7.6%, but we reach 100%. That's probably a lot of lessons for Joe Biden that probably his colleagues in the Democratic Party are trying to teach them that there's probably a better way of doing their health system beyond Obamacare and getting this. And I think I don't really underestimate the challenge of putting together these databases. It's a massive challenge. I mean, there's a massive amount of data, and I think when we're asked to say, well, what else can you do? I mean, I think there's already been a great job done just in getting the amount there onto the database. But there's I think having got to this point, I think there's probably a lot more that could be done. I thought Camilla had some great ideas. I mean, as an organization, Development Pathways, we do use data a lot, particularly in our country-specific work, but we're increasingly trying to look at a global level to sort of compare systems and countries. But at the national level, I think up to now, I think what we've found is that many of these global databases have not been that useful for us to a large extent, because I think much of the information, I mean, it varies across databases, but much of it, when we actually get down to work in a country level and look really in detail, we find that often the information's still incorrect, which to a degree undermines, the credibility of databases. What we've ended up doing often is having to do our own work at a national level and dig the data out again. So I think it's really essential for these databases, and I really admire the effort the ILO's going into to try and enhance the quality of this, and the validation efforts to try and get the data and make certain that it's accurate. I mean, having a glance through, I can still see that there's still some few challenges still, perhaps, in terms of getting the data quite right. I've been working recently in quite a lot in Sri Lanka, and I think I just looked at that as an example of a country and found perhaps the level of expenditure, which I think is probably taken from the IMF, it's probably too high at 3.2% of GDP on the non-health social protection, and also the means tested old age pension disability benefits in Sri Lanka aren't mentioned yet on the database. I think there's still, but I think we've got to see this, this is all about an effort of continuous improvement, continuous enhancement. So I think continue to move forward, finding where things can continue to be improved would be great. And I think what would be really useful on the database is that when people like myself are going through and looking at data, when we actually know about what's in countries, having some kind of portal or some kind of means of letting the ILO know that we've found some change, some challenges with some of the data, let you know, so that you can then check it and improve it. I think that would be really helpful. I think in terms of looking at some of the gaps and how it could improve, what I did notice, which I think is great, the database is following a sort of life cycle or life course, approach, looking from childhood to old age. What it does mean, though, I think there's a gap in certain countries in terms of what I would call these poor relief programs. These are the programs for often household-based transfers for the very, very poor. A number of them seem to be missing because of the way that the database is set up. So, for example, the Benazir Income Support Program in Pakistan, it's Pakistan's largest program, but doesn't figure on the database because it doesn't fit into the existing categories. I mean, a lot of these programs aren't great, I think, in terms of what Camilla was saying in terms of the very low transfer values, the low coverage, but they still exist in some countries. They're really, really important. So that in a few countries, just looking through, I think there's a sort of gap on that. I think in terms also, I think following up on, you know, Camilla, I think in some schemes on the database, we see that we do have the actual transfer value. So for disability benefits, particularly the tax finance disability benefits in the database, we do have the transfer values in the national currency. Strangely, I think I couldn't find them for old age pensions, which I think would be a real miss. And I think it's that's actually getting the data on the exact transfer value would be really, really useful to have right across all of the different programs. That is, how much are people receiving, so that we can then measure, as Camilla was saying, the generosity. I think, you know, while it's aggregating to a degree as well, some of the sort of coverage area or the type of schemes around childhood, around different types of working age benefits and old age benefits, it would be great to actually to then continue to dig below that and start, you know, putting more detail on the actual specific schemes, the names of the programs and the number of beneficiaries, and kind of continue to get that, because that would be really, really useful for data, save us having to dig a lot of information out ourselves. I mean, another thing is, you know, I think you'll have seen we've done a lot of work in ourselves in terms of looking at targeting errors on many of these programs. Be great to have something like that in where we have the information. Often this is taken from a household survey database, a lot more work, but that would be really, really useful in terms of knowing the quality of some of these programs. Another issue, which I think, which Camilla mentioned in passing, it'd be great on some of the working age benefits and you know, the other benefits for children, to know whether the extent to which they have sanctions and whether they're sanction based, you know, whether they have conditionalities and whether, you know, sanctions are imposed. That's a really useful thing to know. And just finally, just going through, you know, I was really trying to find data on Mongolia, but for some reason, Mongolia's got such a fascinating system, but I just couldn't find Mongolia on the database. So I don't know if there's any problem there or whether that's just a glitch that I couldn't find. But I think, you know, that there's perhaps one or two areas, but I think getting these filled up, particularly on very interesting countries like Mongolia, which has very high coverage across a range of different benefits, would be really, really interesting. In terms of how it would, you know, help us in other work, I think what we try to do is, you know, a lot of the time is when looking at countries, to try to find some way of getting consistency in the data so that we can make comparison between countries. So, for example, you know, getting the same age category. So I think a lot of the data here is, you know, related on pensions and is related to the pensionable age in the retirement age in the country, but they vary between countries. So perhaps getting some standardization, perhaps, and coverage for everybody over 65 or over 60, that might help in terms of the standardization. I think I mentioned earlier about the transfer values, where, you know, to get that information be great, but then also to get some kind of standardization so we can begin to measure the generosity, even where it's easy for the reader to look. I mean, one simple thing is to just translate it into you know, into dollars or into dollars and purchasing power parity terms, and then perhaps, which we often use as a comparison to show the ability of the country to provide a transfer, is perhaps to put out the transfers as a percentage of GDP per capita. That's a way in which we can sort of standardize the measures, and we begin to see how generous our different countries are in providing what they're doing. And I thought you probably got a big challenge where you can see the coverage on disability, as I think recognizing that data on numbers of people with disabilities varies a lot between countries. That might be something that you want to look at in a bit more detail when you're giving the sort of percentage of people with disabilities covered. You know, what is the actual baseline of that, and perhaps there's a different way in which it could be done. I think, although you sort of mentioned that the ILO doesn't like to rank countries. I mean, I think it would be great to do further work on sort of measuring the effectiveness of schemes. You know, I think looking at building what Camilla has said, and I think we're trying to do this ourselves, and we hope to get a paper out soon in terms of ranking old age pension systems, is to look at things like combining coverage and transfer value together to get some kind of indices that could you know, that we can be used to measure, get some kind of score behind countries to really see how generous and how effective are they, one, in reaching people and also providing them with an adequate value, at least of a minimum value of transfer. So we hope to put some work out on that very soon. And just as a final thing, because I've reached the end of my time, I mean, I know it's a challenge to do this, and I know that, you know, organizers don't want to put value judgments on, but it would be great to see whether the ILO, in terms of the programs that are set out there, do you consider some programs or some to be actually rights-based, or some that are not rights-based? There's a kind of value judgment that would be interesting, I think, for everybody to see, because I think some programs are clearly rights-based, but many social protection programs aren't, and it'd be good to highlight those so that we can see how we can focus on this program, see how they can be improved so that they actually do become rights-based and allow everybody to be able to access the program absolutely when they require it. So I'll just finish there, and congratulations again on a fantastic piece of work and getting this together. And I'll probably go back to spend a few more hours looking around it and trying to learn much more for myself. So thanks.
Thank you so much. There's a lot of food for thought there. And unfortunately, we're a bit short of time. I just want to tell you that the data for Mongolia is coming up within the next couple of weeks, and also for Palestine. So you can go and play with the numbers when it's up. So good news there. And I think there are a lot of interesting ideas there, and we would love to see your pension paper if it ranks countries according to different criteria, some of which are obviously key ILO principles in terms of adequacy and coverage, and maybe solidarity and financing. These are obviously issues that are very close to our hearts, and we're having a closed meeting coming up on pensions in light of ILO standards over the next week. So we would be very interested in seeing your paper whenever it's done. Thank you so much. And I will now have to quickly move to our last, but certainly not least interesting, important segment of our meeting today, of our launch event. And this is really when we want to dig down a bit deeper, because all of you have been referring to the importance of what happens at the national level. And I'm really, really thrilled to have three excellent speakers with us for this last segment. Two from national social security institutions, and our last speaker, who's from the WIGO, the Women in Informal Employment, Globalizing and Organizing organization, civil society organization. So let me start with our first speaker of this last segment, Gloria Syaka, who's the director of the National Institute for Social Action in Mozambique. And it's really great to have Gloria with us. It's a real pleasure because we have great colleagues who are working in Mozambique very closely with the National Institute for Social Action, and we're very privileged to have the director of the institute here with us. So Gloria, the question for you: we understand that Mozambique has taken some really important steps in recent years towards building a national system of social protection statistics, including the production of a statistical bulletin with the collaboration and participation of institutions in the social protection sector. This obviously is very important in reducing the kind of fragmentation that Fabio was referring to. So could you give us a bit more detail about this interesting experience and what the next steps are? And I have to say, you only have 10 minutes, so grateful if you could keep to that time. Over to you, Gloria. Looking forward. Gloria, we cannot hear you. Maybe you're muted. Would you like to try again?
Thank you very much. Good afternoon, everyone. So I will talk about our experience, but first of all, I want to grateful for everyone to learning and share experience for Mozambique. So, next please. For introduction, for robust national statistical system on social protection are a condition for ensure adequate monitoring for process and the expansion of the national and international level. SDGP indicator aims to implement national appropriate social protection system and measure for all, including flows, and by 2020 achieves substantial coverage of the poor and the vulnerable. But currently, only 45% of individuals worldwide are covered. To measure progress to SDG and to design better targets and effective policies at the national level is needed to improve statistical data on social protection in all countries, including developing countries like Mozambique. Next, please. The government of Mozambique, in collaboration with ILO, was been promoting actions to improve robustness, quality, and reliability of statistical data regarding social protection in Mozambique, both on the contributor and the non-contributor pillars of the national system. We have this illustration where we can see the contributes to better decision making, properly measure progress in the consolidated social protection flow. So both impact poverty reduction and reduced inequality. We have good practice to improve statistical data, social protection in Mozambique. Following the technical training on statistics and social protection provided by ILO to PALOP countries in 2018, Mozambique constituted an inter-ministerial group, Minister of Labor, Minister of Gender, Children and Social Action, National Institute for Social Security, National Institute for Social Action, National Institute for Social Providence, and the National Institute of Statistics. And since then, was able to prepare and publish 2 early statistical bulletins on social protection, 2019 and 2020. Next, please. Social Protection Law 4/2007. This law have a contributory social security scheme, non-contributory social protection scheme. They completed social security private. So, for social protection coverage in Mozambique, total population is 29 million population is total. The coverage is about 1,002,000. In social protection coverage, beneficiary household of inner social protection programs. We are talking about since evolution since 2011 to 2020. We are talking about non-controversial social protection in Mozambique. So, non-contribution is program about we working. We have basic social program package. One of them is a PSSB. This is cash transfer for poverty households with no capacity to work. We have another program, PASD, we call PASD. PASD is in kind of cash transfer for poverty household with no capacity to work. We have other program is PAUS. This is institutional assistance in social units. We have process, this monitoring and assistance throughout family orientation and integration. We have a last one, PASP, is cash transfer for people able to work throughout the performance of public works with the use of intensive works. Next one, we have this graphic for basic social protection coverage in Mozambique. We passed for found in this coverage in percentage. Total of percentage is 65% female coverage. Management information systems we call INAS. INAS is available on the ISSA staff. ISSA staff is a network government electronic platform to all delegation of INAS. 8 modules developed to respond all process chain. Centralized and comprehensive system for all basic social security programs. Information produced in the delegation immediately available at headquarters to support the decision making. AINAS benefits immediately availability for information on beneficiary management and free of errors in manual handling. Availability at end time of all beneficiary information, individual and all levels of aggregation that are necessary. Increased precision in identify the more need for priority beneficiary in the allocation of benefits. Increased processing and payroll control. Monitoring and evaluation plan. For monitoring, feed the sector's performance indicators, analyze occurrences, and stimulate the provision of solution. Accountability, ensure the communication of the process between the different intervention unities. We are talking about the INAS, beneficiary, community, etc. Ensure the best structuring of intervention cost. Learning operationalize and validate the corrective plan, improve all process inherent to intervention, geographic coverage, register, targeting, enrollment, cash transfer. Mozambique Social Protection Response Plan to COVID-19. Our plan is to assist 1,102,000 vulnerable households in urban and peri-urban areas across the country with 6 months payments, approximately $20 per month, throughout the enrollment within past the post-emergence covered COVID program, already existing in the National Social Security Strategy 224 program designed to be activated in the aftermath of a shock previously activity to respond to the tropical cyclones in 219. Payments to be done through mobile payments, more effective, efficient, and quickly. Perspective. The operationalization of the interinstitutional commission that will be responsible for the collection, systematization, and analysis of social protection statistical data in the country. The creation of the common database of social protection statistics in Mozambique. We are talking about the interoperability between contributor and non-contributor pillars. The alignment of the production of statistical information with the SDG, the sustained production of yearly national bulletins for national protection statistics. So this is all for gender equality and social welfare. Thank you very much.
Thank you very much, Gloria. And I'm sure that we will come back, hopefully, if we have some time, with questions for you. If I may now move on quickly to our next speaker, to Champopan Siritorn, who's the Director of Research and Development Division in the Social Security Organization in Thailand. And we're really interested to hear from you a little bit more about recent developments in Thailand's social protection system in the statistical field, and what you see as the important challenges that you have now in creating this integrated system of national statistics on social protection. And is this a feasible project in your country? And what are the main challenges? And if you could please try and stay within the time so that we can finish only a little bit later than was planned. Thank you very much. Over to you now.
Thank you, Shara. It's my pleasure to be presenting here. For the Social Security Thailand, we cover the private employees. The employees of private companies around the Thailand. So we cover around 16 million workers from the 38 workers in Thailand in the labor force. So what we have been doing now in the social protection statistical area is that we have been sharing our data with other organizations to make use of the data most. So right now we have the data, which is the micro-transaction data of the 16 of all the insured person in the system. And these data have been shared within the Ministry of Labor with other organization within the Ministry of Labor. For example, they have the National Labor Center, which provide the dashboard that has the warning system for the labor market. And our Social Security data has been a major part of their dashboard that has been integrated in their system and used as a monitoring and warning tools for the labor market and unemployment as well. And apart from the Ministry of Labor, we also share the data with the Bank of Thailand, the central bank. So they have been analyzing and using our data together with us, especially on the unemployment benefit, which is very crucial this year after having the COVID-19 crisis. So this data has been used extensively for that on the Bank of Thailand, the central bank side, in formulating the economic policy and monitoring the economic condition in each sector or each industry. So they also have their own dashboard that monitor the well-being of each of labor in each sector. And our tourism, for example, has been affected quite a lot. So that is also an information that helped them design the not social protection, but the policy that indirectly would be benefit in the social protection as well. And apart from the central bank and the Ministry of Labor, we also share our data to the National Economic and Social Development Board, as well as the Ministry of Finance. So these data have been used to evaluate and help them in designing the aid for the people who struggle during the COVID time, the COVID crisis. So the use of the people who are still in the social security system means these people still have job, and then they are still doing well, while others who are not in the system might need the special programs, special aid, and they use the data together with other database to manage and find a solution for those who are in need and those who are maybe living under the poverty line or need the special assistance during this time. And also, last but not least, we also coordinate with the Ministry of Health in using the data together to evaluate the quality of the medical treatment and process, as well as some unusual claim in the system. So together with our system and other health system in Thailand, there is a center organization that incorporate all the data together, and then they analyze on the basis of the national to see the trend and to see the quality of the treatment of the healthcare system and also the hospitals, and use this to find the indicator and use it as the measure to improve or to detect some improvement need to be done in the future. Yes.
Okay, great. Thank you so much. That was very helpful, and thank you so much for also keeping within time. And again, I hope that there will be time for us to come back. If not now, maybe bilaterally, there may be questions for you. I want to now turn over to Laura Alphers, who's the director of the Social Protection Program of WIGO, the Women in Informal Employment, Globalizing and Organizing. Laura, I'm sorry that you're the last speaker on our panel, but I assure you that everyone, we're very eager to hear you speak. As an organization that's advocating for the rights of women informal workers to Social Security, we would be really interested in hearing your thoughts about the social protection dashboards that you saw hopefully a glimpse of, and I know that you have been hopefully using the older version of it for your work. So we'd be very interested in your thoughts about how these dashboards and the work that the ILO SOCPRO department does can become even more useful for the work that you do, particularly the advocacy that you do for the rights of workers in the informal economy, particularly women informal workers, to have their right to social protection. So over to you, Laura.
Thanks, Sharon. Thanks very much for the invitation to be here. First of all, just a big congrats to the ILO team on the dashboard. It looks great, and it's definitely in using it to give presentations to organizations of informal workers is going to beat the very grainy, horrible little screenshot I took out of the World Social Protection report last time and put up on a PowerPoint. So it's great to have the visuals and all of that. Data is incredibly important for advocacy. WIGO has spent more than 20 years working alongside the ILO to improve the data and statistics on the informal economy. And so we're an organization that understands the importance of data. And I think, we do use the World Social Protection Report's data, particularly at global level when we're trying to make a point about sort of access to social protection and the missing middle of the informal economy. We do advocacy ourselves around Social Security, but one of our big roles is to try and enable organizations of informal workers themselves to do advocacy for themselves around social protection. And so we play a big capacity building role as well. And so I've tried also to look at the dashboard perhaps through the eyes of an organization of informal workers as well. Not hoping to speak for them, but perhaps to pick up a few issues with accessibility that might come up and might hinder more widespread use of the data from more sort of grassroots organizations. And I think that's where the infographics and the maps and the way the data has been presented is incredibly important. It's just up the accessibility of the data, and I think that's really important to get more people using the data for the purposes that it should be. I think the gender disaggregations are great. We also work a lot with informal worker organizations in which women themselves have quite a hard time making their voices heard for the forms of social protection that they prioritize. So having data there showing the gaps between men and women is also really important, because that's something you can take to the organizations, and it can give women within organizations power to say, nobody has a maternity benefit, so that's what we have to focus on, or whatever the issue might be. Those kinds of things can often be drowned out. And I also really enjoyed in the legal coverage in particular the breakdown between contributory and non-contributory coverage. I think for informal workers in particular, it's quite important to see how many are excluded from the contributory coverage, but that there is some coverage in the non-contributory systems as well, which is great. So yeah, it's wonderful to have these dashboards. A few comments about sort of gaps and things that I think are still an issue. I would say there is still some issue with accessibility. I myself am not great with data. I have a lot to learn, but I'm also thinking about informal worker organizations trying to access. I think there's a lot of issues around terminology and actually understanding what it all means. So we have effective coverage, we have legal coverage, we have the labor force versus the working age group, are informal workers in the labor force? If I have to then go and do some research to look up and see, well, who is actually included in the labor force versus who is included in the working age population. There are footnotes about effective coverage for sure. They're not on all the pages, and it is still quite technical trying to get your head around what effective coverage actually means. I struggle to find anything. I mean, I assume legal coverage is coverage in law, but it's not always clear. So it adds a bit of extra work. And I wonder if there's also some way to include some very simple language about what all these terms mean, and perhaps some guidance about, well, if you're doing advocacy with the national government, should you be using the legal coverage or the effective coverage? What should we be using in that respect? What's going to actually make our argument stronger? And then I think just a comment about like looking for informal workers in the data. It's not always simple just to find them. And I think that, obviously in the legal coverage, you can work out who the informal workers are by who's not covered by the contributory social protection, and try and get a sense of, well, they may be covered by the non-contributory social protection. But I was looking at one point to try and get some information on, what was the effective coverage of informal workers. And it's a struggle to find that. I can't. So I assume they're covered under the vulnerable population, but I can't go up to a group of informal workers and say, you guys are the vulnerables, along with the children and the older people who don't get access. So I think that there is something to do to unpack informal workers. I know it's part of the SDG indicators, so it might be difficult to do that. But I mean, if one thing this has shown us is that the coverage gap in the informal economy is huge, and I really think it's important to kind of emphasize that in very clear kind of ways on the dashboard. So how many informal workers actually have access to social protection, or at least one social protection benefit? I mean, it's you've got to do a bit of homework to find that, and I think more could be done to really emphasize that point, which would be useful to us as well, quite frankly. And then I also just to agree with some of the previous speakers around adequacy. It's a big concern for informal workers having non-contributory benefits that are such low value extended to them when they are extended to them. These are working people obligations, and often that is the problem. Is actually the benefit is just too low to be meaningful for them, and it's hard to come up to a group of informal workers and say, well, you should be happy because 66% of you are covered by a disability benefit, when that actually that's not necessarily a meaningful benefit. And then I think probably something on qualifying criteria for some of the schemes would be potentially, again, just thinking of the disability benefit in South Africa, people would want to know, so who qualifies and how. That would, we can look that up as well, but it would be something useful to add to the database. But yeah, that's all from me, and thank you again. And yeah, I'm looking forward to using this new database. Thank you.
Thank you very much, Laura. That was really helpful and a very nice way to maybe think about some joint ILO, SOCPRO, WIGO work on making some of this data on a special page particularly available, visible, accessible, and analyzed from the perspective of the informal economy, and informal workers. Maybe that's something to think about for the two organizations together. So thank you, colleagues. Thank you for all of you who have been taking part as a panelist. I think you've given a lot of your time, a lot of your ideas, and I think we had a really, really interesting set of presentations. And I hope that our audience was able to at least get some answers to the questions they had, and also to be able to see some of the links to the various reports, to the dashboards, to other pieces of evidence that was referred to during our sessions. And from socialprotection.org, they're telling us that they will share them again on the chat box, all the links that were provided. So I think that also will be very helpful. We obviously all have a lot of work, a lot of homework to do. I think obviously the whole issue of how we can strengthen and reduce the fragmentation of social protection systems in many developing countries, and the challenges that that implies for creating comprehensive and systematic statistical systems in social protection is really the, the key issue, challenge, but also where we can get hopefully very good results with more investments of resources, of time, of expertise, and that, as I think something the ILO takes upon itself in supporting that kind of institutional strengthening, I think is very important, particularly also challenges for data collection and the role that tools like the SSI can play to support countries in facing these challenges. I think we're hopefully in that to support countries. Also, very importantly, I think the need for investments in statistical systems. We have seen a lot of progress made, but there is a long way to go. And I think we heard a lot about how, even though our existing dashboards are an improvement on what there was previously, we are very aware that more needs to be done in terms of issues of making, not only making the kind of data more improving the quality of it by bringing in greater issues around adequacy of benefits, around the quality of the benefits that are being provided. But also, I think there were a lot of interesting messages there around how the information can still be made more accessible, more available, easier to understand, so that people don't have to do a lot of navigation to get to the kind of data that they want. So we will definitely be reflecting on a lot of what you shared with us, and do continue engaging with us. And I think my colleagues provided also names that you can address questions to. Please feel free to come back to any of us with any questions that you have as a follow-up to this initial launch. And thank you very much for the generosity that you had of spending your time and giving your attention and your wisdom and sharing that with us in the Social Protection Department, but also all our colleagues who were online, as well as the audience who was online and who contributed to a very lively conversation in the chat box and the Q&A session. Thank you very much. And with apologies for having gone 11 minutes over time, I wish you all a very good evening, afternoon, morning, wherever you are. Thank you and goodbye.